I'm Sinan Tejani. I'm a physiotherapist working in Burnie in Tasmania. I've been here for the last 3 years now. I love being a physiotherapist. There's days that I love what I do, and then there's days that I don't feel very good about it. But I love sport. I love helping people, and I think that's one of the things that keeps me going. I love sports so much that I really wanted to be a sports physiotherapist. That was my dream growing up. I wanted to work with a team, wanted to work with a soccer team, and that's why I decided to be a physiotherapist. So I came to Australia in 2015 to do a master's in sports physiotherapy, and part of the course had a component of persistent pain to it, and that sort of really sort of spoke to me. And I guess when I came to Tassie, I came to Burnie, a massive amount of my community is suffering from persistent pain, and I think ever since then I've been doing a lot more work in that sort of area. I did have a personal experience with pain. When I was in India in 2014, I think I injured my neck in the gym. Relatively innocuous sort of injury. I thought it would settle down pretty quickly. And I tried to keep going, but for some reason it just wouldn't go away, and kept coming back. It used to really upset me because I couldn't run, I couldn't exercise. My lifestyle suffered. I got really obsessed with how tight my muscles felt, and I really tried to do a lot of things, passive things, to change that, but nothing really made a difference. When I came to Australia and when I studied persistent pain a bit in uni, again, it made a lot of difference to me because I started to realize what I was doing and what I was doing wrong, really. And look, I haven't suffered a lot. I haven't suffered as much as a lot of my patients have, but I see what difference it made to me in a small way, and I think in principle it can help every single person who deals with this on a day-to-day basis. I'm not a cyclist at all. I only started cycling about 4 months ago. One of the reasons why I wanted to do this is that when I tell someone the exact opposite of what they've been listening to from other health professionals, I'm asking a lot of them. I'm putting them out of their comfort zone. I'm asking them to change a big part of their thinking. And I guess for me, the ride was similar to that. I wanted to push myself out of this comfort zone that I've created around myself, and see what it feels like to challenge yourself, or challenge your thinking, or challenge yourself physically and mentally. Nowhere near as to suffering from pain on a regular basis, but it really has been very challenging. It's been, personally, I've grown a lot from the experience, and I think that's what I wanted. And obviously I wanted to do something for the community. Because of me doing the ride, speaking to people, telling people about it, raising money, I've had a lot of support from my own small little people that I see, and that's been really inspiring as well. So yeah, it's been really good. So Burnie is a beautiful little town on the northwest coast. It's actually a city. Nice little place. We've got some brilliant produce, really good coffee, something that I love, and really there is a problem here. 1 in 5 Australians suffer from chronic pain or persistent pain. I think that number is true. Could be even higher, because a lot of my patients do have a lot of these issues, and it's been really challenging working here, because there are times that you feel that you're fighting a losing battle, or you feel really alone because not everyone's speaking the same language. But then there's days where you really get through to someone, and it is just the best feeling ever as a physiotherapist, or as a person who's helping people. So I guess that's what Burnie's like for me. I think there's a lot of issues. There's a lot of systemic issues where the health system is under a lot of pressure, because we've gotten used to seeing health practitioners on a regular basis, and it's very accessible, and often that makes us a little bit dependent on things like that. Obviously there's an epidemic as far as opioids is concerned as well, so that's an issue. there's not enough skilled professionals who should be speaking the same language. You know, you might tell a patient that they don't need to worry about their degeneration, but then they might see someone else who said, no, you know, that's not really right, you need to be really careful, you could end up in a wheelchair. That's something that's a common theme. So I think that's a big barrier, that we're not all speaking the same language. We're all wanting to help that person, but we're not, we're pushing them down a pathway where it's not really helpful. One of the things that I have felt like in the last 3 years that I've been working in Burnie is that when I speak to people, and then when I tell them that, you know, this is what pain is, and, you know, when I try and change their understanding of it, it makes such a big difference, even to people who don't have persistent pain. You know, it resonates so much when you talk to them about it. And I slowly realized that that educating people or talking to people is really the best way to fight this. And that's one of the reasons why I decided to be an LPE, because as an LPE I'd be going out in the community more, talking to people who are influential in the community, so we can make more of a change as opposed to me just being in my own little practice. So that's one of the main reasons that I decided to be an LPE. Also, I get to connect with different health professionals who think along the same way, and I think that support's really important to keep going in making a change.